I'm Maggie Jackson.
I'm Ray Johnson.
And we're with the Garfield County Health Department. We're sitting 6 feet apart, so take our masks off. So it's almost Thanksgiving, and we have a lot to share about all of the action going on with health in our community, mostly surrounding COVID-19. We really want to talk about something different, but it's so important that is at the top of our priorities as we're going into Thanksgiving week. So I wanted to share first our phone number for the Garfield County Health Department. It's 580-233-0650. Our phones have been ringing off the hook. This week we did 228 tests on a drive-through, and we're now averaging over 50, 60 tests a day at our health department because there's such a demand for COVID-19 testing. So the first thing I want to start off with is please get a test. This is the phone number you call, you make an appointment, it's free, no insurance needed, and you can come and that you just have to fill out some paperwork and we'll get you set up. You'll just need your ID when you come. So we do all that testing outside. It's tough on our amazing nursing staff and our other staff. They go out, rain, they've been out in the ice storm. They're amazing. So that testing is very safe, and it helps us not expose potentially our other clients. And so just so you know, it's a safe way that we keep testing every day. And on that note, we typically take walk-in clients when we do STD testing and other appointments. We can take walk-ins. Now, with the high demand of COVID-19, we need everybody to make an appointment. So save that phone number. It's also on our Facebook page. So we want to start off with that you would stay in touch with us if you need a test, if you need other health department services. We're still here for you. It's just a busy time. So Ray's going to jump in on our recent COVID numbers, which have been very eventful.
Yeah. So on Fridays, the alert map is shared. So it takes the 7-day average of our cases per 100,000. And today we are at 72.6. That is the highest we have ever been. The entire state is in orange, and the entire state is higher than we were last week. It's if we'll go to the next slide, we can look at Garfield. So if you look on the right there, those are just our numbers for the past 5 weeks. And you can see last week we were at 67.6, and this week we're even higher at 72.5. So our cases are just increasing. And I think we all know Enid Public Schools is again going to stay virtual this week to keep staff and students and try and keep the community safe. So hopefully we can, get those numbers back down and get everybody back in school. And then the next slide, we can talk about our case numbers for the day. So there's our where the state is at. Pretty much every day this week, every single day, there's been an increase of 2,000 cases per day for the state. It is our cases for the state of Oklahoma are growing at a rapid rate. It's pretty crazy. It's definitely the most we've ever seen, and it's every single day. It's not just like a one-time event. It's steadily rising. And then for Garfield County, our number total today is 3,224 cases. So we've gained 309 cases from last Friday. We've had 33 deaths in Garfield County, and we've gained 2 from last week when I was here. And we've have 2,671 recoveries, and 169 people have recovered from last week. And our active cases are now at 520. Last week when I was here, it was 138 less, so that's a big increase on people that are actively sick. And we, like Maggie said, we had to close the health department on Wednesday to just get caught up with testing. And when that happens, we will likely see a big increase of cases because that many people felt they needed a test for one reason or another, whether they were ill or thought they had been exposed. And with the exposures or being ill, we are all aware that it's Thanksgiving, and I know everybody wants to gather. And the Oklahoma State Department of Health has come up with some press releases and some messaging, and I created a slide that we'll talk about in a little bit, but we just know the science shows that the best way to protect yourself is by masking, by social distancing, by using hygiene, staying home if you're sick, and staying home if you've been exposed. And I think Maggie was going to share something else before we talked a little bit more about Thanksgiving.
Oh man, so just thinking about Thanksgiving, it's my favorite holiday, and I hate this because it's the only holiday that's not commercialized, and I just love it. And my birthday's in early December, and every year on my birthday I get a cold or I get a stomach bug. I'm sick every year on my birthday, and I'm pretty healthy, but it's that gathering every year, and it's worth it. Usually I'm with my nieces and nephews. I don't care if I get a cold just to get to hang out with my family. But just looking at where we're at this year, it's not worth it. It's not worth it. And like we've said since the beginning, 80% of cases are mild illness. We're seeing a lot of people weather this virus just fine, and it's that 20% that we are really just trying to not spread it to those who might be hospitalized and who might unfortunately pass away. So what you don't want to be is a link in the chain of spreading the virus. So even if you're young, you're 18, 35, in that big group, we got a lot of cases in people 18 to 35. And those folks, you're not as worried about your health. But what you can be is someone who spreads it to someone who's vulnerable, someone who has to miss work, someone who might be hospitalized. And it's just math. I mean, 10%, 8 to 10% of our cases have been hospitalized, and 1.1% are dying. And that hasn't really changed in the last few months. So as our cases increase, you may not be worried about cases, but 8 to 10% of those will need to go to the hospital, and 1.1 will maybe die. And that's when, we can't speak for what's going on in the hospital today, but we've heard them say in the last few weeks, both of our great hospitals here, they are state of the art, they are great at treating patients, they know what they're doing, they're up to date on all the latest science, but there's only so many hands, and there's only so much equipment, and it is short. So the other reason we're looking out for those hospitals is that you may not worry about COVID, you may not get COVID, but you might have a child with an asthma attack or someone with a heart condition. These things are going to continue to happen like they do normally, and if there's less room because of COVID, there's less room for people that have those issues as well. So we're not trying to scare people. I've seen a lot of people say, don't live in fear this Thanksgiving, and I don't think that we live in fear. That's not what I want at all. What I'm asking is that you think about the person who might need to go to the hospital for a heart attack. If you think about the person who is maybe your family member that may not weather this virus well, that's why we're trying to slow it down again, guys. I've heard a lot of people say, we're going to have to live with this. It's just how it is. We do have vaccine planning in the works. The vaccine is on its way. We're going to get some doses for a few healthcare workers soon, very soon, which is exciting. It won't be available to the public maybe until the spring. We're guessing around April. So that's encouraging. There's some hope with that vaccines only work as much as as many people have them. So as great as that's going to be, and it gives us some hope for normal life, we have to hang in there for a few more months. I hope not much longer than that. But we really need you to think about, it's not just about protecting yourself. It's about helping someone stay out of the hospital, helping someone not die before Christmas. Not trying to scare you, it's just statistics. It's just what's happening. And so we're asking you that wearing a mask keeps you from spreading the virus if you are infected before you know it. We know that people can be contagious 2 days before they could even have a positive test or have any symptoms. That's why this is spreading so fast. We're just reminding you that that's what the masks are for. They're for me when I don't know I have it. those droplets stay in my mouth when I'm talking, when I'm close together. If I happen to cough or sneeze, that mask helps some of those big droplets stay inside. It's not 100% perfect, but we can see in countless communities that when lots and lots of people wear the masks, the spread slows down. We did have a study come out this week, and it was really interesting. You know, we're learning a lot as science continues. I love staying up with the data, and I was interested in the study. It was a control trial where it showed where many people where it wasn't normal to wear a mask. If you wore a mask and you were the only one, you're about as likely to get COVID as if you didn't wear a mask. So what this showed me is that it takes a whole community. We have many studies that show when a community has large-scale masking, a policy where most people wear masks, the rate of hospitalizations goes down, and the rate of new cases per day is slower. So we are still learning, but we still have so much science. I want to respond to that study. We're going to share some links to all of the research that I know about, that I use to make my decisions and my recommendations. And you know, my understanding and my interpretation, as well as what the CDC recommends, the Oklahoma State Department of Health, is that community masking can slow down the spread. So if you're interested in that research, please check our Facebook page. I haven't posted it yet, I'm sorry, but I plan to this afternoon because I love learning about data. I'm glad that so many of you do too, and I want to be able to talk through some of those new scientific discoveries. Okay, so let's talk about Thanksgiving.
Again, just like we've been saying, it's really important to take every precaution that you can, and we're not saying don't enjoy yourselves, don't be with your family, but if the weather's going to be nice, I haven't checked it, in Oklahoma it changes.
I think it's going to be in the 60s on Thursday.
Let's eat outside. We're all cooped up all the time anyway, and even more so now with our kids at home. I know I am. But so eat outside. That's a great way to have open air ventilation, less spread. Wear your mask if you're not drinking or eating when you're inside. Think about your space that you're hosting in, and if you have 20 people and you're in a small room, you have a lot higher chance of spread. So maybe pare down your list, have everybody be outside, serve up the food outside, and just if anybody has tested positive or been around a positive, it's the safest thing just to not have them there. It's common sense. It's time to just crack down. Let's be safe. Let's do these precautions so we can get our numbers back down, get our kids back in school, keep our hospital workers safe, and keep everybody safe so we're safe for the holidays.
Yes. I know lots of people are getting creative too. Our vulnerable folks are learning technology. We've got to love on each other this holiday. I mean, family is so important, especially right now. We've got to find ways to show each other love, to spend time together, to be thankful. This year has been so tough on many of us, and I know being thankful is how I get through. So this is my favorite holiday. I don't want to tell you not to celebrate. Please celebrate with your family. And these ideas, I know that if you have everybody in the kitchen, that stresses me out. So maybe this year, cook at home and sanitize your tools and then bring something and eat it outside together. So not everybody's huddled around the kitchen. If you've got a football game, put up a big screen and watch it in the backyard instead of all huddling around the TV. There's a lot of ways you can still keep your traditions and keep this at the forefront of your mind. If we don't, Thanksgiving could be a big reason we see a ton of cases just by family gatherings, which we need. So please, we're asking you, wear a mask, stay 6 feet apart, wash your hands, and be careful this Thanksgiving. I know I'm really excited about good weather too. We saw that the Enid ice rink, the ice rink is opening. I am so excited.
Me too.
I think that, as long as people don't crowd up, at the entryway in general, I think you can ice skate spread out. And so hopefully that's going to be a safe way that we can have fun for Christmas. I saw we're doing drive-through Christmas lights, which is so fun. I know my kids will love that. We can drink hot chocolate and still enjoy the park and still enjoy the holidays, just slightly different this year. Slightly. Awesome. Well, just other health updates. We've had to put so many things on the back burner, but we're still thinking about flu. If you haven't had a flu shot, that's really something that we wanted you to do before Thanksgiving. Get your flu shot. That's another thing we don't want to spread over Thanksgiving. We've got free flu shots at the Garfield County Health Department as well by appointment. Sometimes we even come out to your car to do those too, because we're trying to keep everybody from being exposed. And we're also encouraging healthy eating. Make sure you get your veggies and find some yummy salads and good sides, and remember to take your time when you're eating your Thanksgiving meal. Don't stuff yourself.
And there are a ton of recipes. They're really easy to Google. Just ways to cut down on the butter in some dishes, or things still taste delicious with half the amount of butter, or maybe pare down some of the sugar, and you can find lots of ways to still have healthy eating for your Thanksgiving meal.
Sure. I think we can share just some of our favorite recipes that are slightly healthier for the holidays too over the next week. Are there any questions from Facebook or comments? Great. No. Well, is there anything else we have?
Nope, just stay safe, everybody.
All right. Thank you so much to the City of Enid for having us. We really appreciate this platform and getting to share with you guys. We really care about this community, and we want to see, everybody out of the hospital and safe as can be. So help us, Enid. Help us do your part. Wear your mask. Stay 6 feet apart. All the things we keep saying. And have a happy Thanksgiving.
Yeah. Happy Thanksgiving, Enid.